Hi everyone, Ashok here from DHP. Today I have a special guest joining us today talking about naturopathic medicine and traditional Chinese medicine and the combination of that and its role in patient care. It's my pleasure to introduce my friend and colleague, Dr. Grace Chang. She graduated from Bastyr University in 2016 with a doctorate in naturopathic medicine and a master's in acupuncture and East Asian herbal medicine. She's currently the resident physician at Natural Medicine of Seattle, providing primary care, emphasizing on digestive conditions, eczema and allergies, endocrinology, and sports medicine. And she's also providing individualized IV nutrient therapy. So, welcome.
Hello, thanks for having me.
Absolutely, thanks for joining us. So first off, what got you into the field of medicine? You know, what drew you to doing naturopathic and traditional Chinese medicine?
For sure. So I feel you can't answer that question without going from the very beginning. So
Yeah.
I spent the majority of my childhood in a restaurant. So I learned at a very young age the relationship of food, nutrition, and medicine. So the kitchen was our medicine cabinet. Anytime anyone in the family was starting to feel under the weather, it was addressed by soup with like spices and ginger and or a tea with different herbs. So that was my relationship with medicine to begin with. And then fast forward to college, I was very focused on physical therapy. I wanted to go to physical therapy school. I loved the hands-on that practitioners get to do with their patients, but I also felt there was a limitation. You couldn't talk about nutrition. You couldn't talk about what was happening at home or the medications they were taking. And so it just so happened there was a naturopath sending patients over to where I was working and got me into naturopathic medicine. I shadowed him and then I applied. So I find naturopathic medicine is a way of life, and I can dive deeper into that, but it's just something that I can address the foundations and how to treat a whole person and everything. So
Cool.
yeah.
So doing both, you know, the naturopathic medicine, which is kind of bringing in that nutrition and foundations of health and lifestyle into the PT side that you were considering first. How does that combine with the traditional Chinese medicine?
Traditional Chinese medicine, I think, is amazing because the entire theory rides on this idea of qi. The body's vital force. It's not solid, it's just something that flows within you, and it's the ability to heal. It's the ability to, of how well you can interact with the world. And I think that's one of the only types of medicine, a very few that addresses the body's ability to heal itself as a tool. So qi goes really well with naturopathic medicine in a sense that it is addressing foundations of health and using acupuncture to kind of redirect traffic, if you will, when things are stagnant or you're in pain or something's not moving, a system's not flowing very well. So I don't know if that answers that question.
No, totally. That's very cool. So with the combination of, you know, doing the naturopathic medicine, the traditional Chinese medicine, have you noticed any like trends? Like, is it increasing in popularity or acceptance? Like, are people wanting both, just one or the other?
I am actually seeing a trend in both. I think a big part is that insurances are actually opening and covering a lot of alternative modalities like acupuncture and chiropractic care. But in combination, I think a lot of people want more. They want answers. They're not finding it in an antibiotic. Like, why am I having reoccurring infections? Why am I having pain after surgery? I think a pill is not enough, and they want more. And I'm finding that people are seeking naturopathic care and acupuncture in a sense that they're not feeling well, even though conventionally they're supposed to feel well at that point after,
Right.
So
Cool.
Sorry.
No, that's great. So that actually leads into something I wanted to ask, is that, from the practice perspective, yeah, you're looking at the foundation of health in naturopathic medicine, you're looking at the flow of qi and their nutrition in traditional Chinese medicine. So how do the philosophy and the principles of each medicine present themselves in practice? Like, do they mesh? Do the principles come up?
At this point in my practice, I feel like both of them mesh very well, and I can no longer distinguish between the two. If I'm doing an intake for a new patient, I am, asking about not only how they sleep, but also just like mental, emotional, the level of stress, and when they are stressed, where is that physically showing up? So I'm incorporating TCM or traditional Chinese medicine questions into my intake. And also, God, I already forgot the question. In other words, I also feel both modalities consider imbalance. Okay. When disease come on, it's because of an imbalance, and they're trying to restore balance. So how do we do that? There's a therapeutic order I think both addresses. That one, first do no harm, or two, using your own vital force to fight something off. But three, what else can we incorporate? Herbs or medication or even surgery, something that maybe they need. So both philosophies marry very well in that aspect.
That's very interesting. That's actually really cool, because you brought up actually a lot of principles in naturopathic medicine, and it seems like they flow really nicely into the traditional world medicine as well.
Totally.
So in practice, what have been the most common conditions or complaints that seem to come to you because of, your dual license?
Yeah, I feel the biggest one that I've seen are musculoskeletal concerns. Pain is the biggest thing. Why am I still experiencing pain? I've popped a bunch of Advil and ibuprofen, or I just had a knee replacement. Why am I still having pain? Yeah. So I think a big part is I'm seeing a lot of people coming in to restore structural integrity. And acupuncture is really good at there's just so many studies of how it can help with chronic pain, back pain, tendinitis, things like that. The second thing that I see a lot is actually digestive concerns. Naturopathic can address a lot of the digestive disorders with herbs or probiotics or things like that, and nutrition and counseling on that part. But also the acupuncture, they incorporate stress as a problem to digestion. So by redirecting all of that, it kind of helps open things up. So I love that part. And then a big part too is stress management. I would say that's the third most. I see a lot of people who are very anxious, and I also recognize that sometimes in order to address the physical, you have to remove the mental emotional layer that may be enhancing the pain or masking it. So unless that's addressed, you can't go deeper.
Can't really go deeper. See, and that's where it gets interesting for me to kind of look at and pose a question to, because, for example, you brought up the antibiotics as a conventional treatment, So some of these conditions, like digestive upset or pain, is there a simple way to just say, okay, here's the conventional medical treatment, let's say, ibuprofen or Advil or, whatever, and then say, okay, here's, take that away and give a naturopathic treatment, or take that away and give a traditional Chinese herb. Like, is it that simple and straightforward?
Good question. So again, I think it goes back to meeting where the patient is at and meeting where the disease is at. Okay. If it gets to a point where, I don't want someone to have sepsis. Right. So if it comes down to that, please take the antibiotic. Okay. But if it's right in the beginning, you're starting to have some symptoms, that can really be addressed with herbs or Chinese medicine, or just staying at home and resting and removing all aspects that could be worsening things. And then you might actually be able to use your own vital force and fight it off. But so I think there's different steps, and as a practitioner, that is my job to figure out where that person is and how can I efficiently rebalance them.
Interesting. So that's funny because it seems like that came up a few times in your answers. Was the therapeutic order?
Yeah.
It's kind of like when they come in with a diagnosis or a conventional medical condition, and you have the standard of care treatment, you're kind of stuck at a therapeutic order in that sense. But when you're able to put on your naturopathic hat or your acupuncture hat, you can kind of move up and down it as you see fit.
Right. And I find it is my responsibility to recognize also my limitations. If someone has suspected gallbladder stones, I need imaging for that. It's my responsibility to send them out and have that visualized. So I think as a practitioner, that is what I'm constantly keeping in mind, that yes, I have great tools in my toolbox, but I also need to know the severity and where everything is. So
cool. So beyond acupuncture or herbs and stuff, what are the most common treatments or interventions that you have done, either from one medical style or the other, or the combination of both?
Okay. So the biggest thing, especially during the season, I'm seeing a lot of sinusitis.
Okay.
Things like that. Sometimes by the time they come to see a doctor, it's gotten really bad. It's gotten to the ears or something else, and so antibiotics are required to kind of call upon. But at the same time, at that visit, before I give them that prescription, I'll throw in a couple needles into their to focus on draining the sinuses, or I will provide them instructions on how to do a neti pot with hydrastis, which is an herb that's antibacterial, so they can flush it out as well, on top of trying to get rid of it with antibiotics. And the biggest thing too is that how do we prevent this from happening again?
Right.
Especially if you have a history of getting sinus infections every season. Like, why is that? So then we work on other things like how do we prepare you for the next time, and how do we get your immune system stronger? And that can be addressed in so many ways, just replenishing the flora, doing IV therapy, doing acupuncture, how is your stress, like so many different things. So,
cool.
Yeah.
Okay, so on that, I'm going to give you a little chance here now to jump on your own little soapbox.
Okay.
Basically, your top 3 things to avoid for general health.
Yeah, I would say my top 3 things is just overdoing things. So overindulging, overthinking, and just plugging too much into your day. Just to kind of go into maybe a little more detail, just overindulging as in, allowing yourself to eat a certain food or have fun and go out and eat it. But, when you overdo something, it can actually hurt your health. It all comes down to balance. Overthinking, we're thinking constantly throughout the day, multiple thoughts going, 500 miles a minute. I think it's easy to get lost in that and to get caught up in your mind. And your mind is the creation of your reality, right? So overthinking can cause a lot of stress in its own. So avoiding that. And then plugging too much into your day. Hustling and being busy doesn't always mean success.
Right.
And when you can work efficiently and get things done and be productive, even if it's conquering a couple of projects a day, that is a good day's work. So.
Cool.
Yeah.
Good advice. Okay, so the next is top 3 daily tips for optimal, everyday, healthy balance.
Yeah, so I would say to meditate, but that's really hard for people, and that can be a little overwhelming when you're trying to physically try to take off time and meditate. So I would say stretch. If you wake up in the morning and stretch, play some music, or you're going to stretch before going to bed, I think those are great ways to kind of stop what you're doing, focus on how your body feels, and you're stretching out and it feels great, but it's also allowing your mind to relax, and you're in some ways meditating with your own body, which is great.
Totally.
Another thing I would say to just do is to walk it out. It's easy to get caught up in the moment and be so zoned in and focused, and you can get really frustrated, whether that's talking to someone about a heated argument or working on a project with the team. It's good to just step out, walk it out, put those thoughts into a motion of action of some sort and then check back in. So I think that's great. And then eat. Again, it's easy to forget that you need food, and whether that's just a handful of nuts or a spoonful of yogurt or something to kind of keep your metabolism going, keep your body fueled. I think that's very important. Eating doesn't always mean a full meal. So those are my top 3.
Okay. And then last is your top 3 overall tips for optimal health.
Yeah. I would say everything, again, in moderation, finding that balance and allowing yourself to have your needs met and also not overdoing things. So everything in moderation. 2 would be to move thoughts into action. It's easy for thoughts to be congealed up in your mind, and unless you put those into action, they'll just keep running through your head. In Chinese medicine, we see pain as a stagnation of qi or blood. So thoughts can also create stagnation. So always either write them down, and that is an action, or don't think at all. And then lastly is just to check in with yourself. We are a well-oiled machine, but we also have so many aspects of us that require attention sometimes. Like, when you are stressed out or you have an ache somewhere, it's your body trying to tell you something. So just being mindful and aware of where you are at every day will help you stay healthy. So
cool. That's fantastic. Check in with yourself. That's good advice.
Yes.
Well, Dr. Grace, I want to say thank you for sitting down with me, sharing your knowledge and expertise. But before I let you go, I know that there's going to be people that watch this and are interested in naturopathic medicine and acupuncture or the combination, or want to know more about your work and follow that. Where can they go? What can they do?
Yeah, so I'm a big fan of Instagram. You can find me at @adose_of_grace, where I post a lot of motivational and also related to my work. And website, www.adoseofgrace.com.
Okay.
And also my work. We have a great group of practitioners that are working in Seattle and have a focus on different modalities and disorders. So that's www.naturalmedicineofseattle.com.
Wonderful.
Yeah.
Awesome. Well,
Thanks.
again, thank you for being here.
Thanks for having me.
Great.